And as we told you, we will be talking about the virus that's been going through the country recently. The virus, the flu, whatever it is. We have with us Dr. Sandra Saroop, primary care physician, who is on set with us with both Rishi and me to talk us through
it's
this.
a really burning issue right now,
it?
you know. I haven't gotten it yet, and I'm thankful for that.
Yes.
So now I want to learn ways that I can prevent myself as well from getting it.
Exactly. So
because Lisa had it, and she can be
I was
contagious.
flattened.
Is she contagious?
Flattened.
No, she's not.
No, she's not contagious.
Dr. Sandra Saroop, primary care physician. Good to have you on the program.
Hi, good morning. Glad to be here.
So many things are, permeating right now. It's the virus, it's the flu, it's swine flu. What? Tell us some of the things that are in the air right now.
Okay, so around this time, we are normally hit with a number of respiratory illnesses, right? And they're normally caused by viruses, right? So there are different types of viruses. You have influenza, you have a virus called respiratory syncytial virus, you have pneumococcal. You have different types of viruses. I don't want to be also technical and stuff.
Yes.
But I just want people to understand that there's a huge difference between influenza and the common cold.
What is the difference?
So influenza is a particular type of virus that you have different strains for. So you have influenza A, B, and C, and then you have different subtypes of the influenza virus. The common cold, however, is caused by other types of viruses, as I named earlier, the rhinovirus, the RSV viruses, etc. Now, the symptoms would look the same. All right, you would have fever, sore throat, body pains, joint pains, etc. But with like the common cold, you might have a cough, which you may not necessarily get with, say, the influenza. So the symptoms are basically almost the same. All right, it's just that with influenza, though, what we're concerned about is that based on the different subtypes, it can be a little more severe, all right? In pathologic terms, we call it more virulent. And it's because of that we get concern, especially with those populations that are vulnerable. So the vulnerable populations are those people who are over age 65, those who are pregnant, those who have chronic diseases like diabetes, those with respiratory illnesses like asthma, and the kids, those less than 5 years old. So those are the people that we are generally worried about.
So let's make it clear. I just have a question, Rishi. The difference between the influenza, which is the flu, right?
Yes.
And the virus is the cough?
No, influenza is a type of virus.
Okay.
All right.
So I'm confused. I'm confused.
So influenza is a type of virus.
Right.
All right. And so it can cause symptoms similar to having a cold.
Right.
All right.
So the difference is between the flu and the cold.
Yes.
That's what the difference is.
Yes.
Right. And the cough comes with the...
So you can have cough symptoms in a cold.
Right, in a
Yes.
cold. Right.
Yeah.
Okay.
But as I said, both have similar symptoms. It's just what's the causative agent. All right. So the causative agent in the flu is the influenza, and that in a cold is the other types of viruses.
Now, you said that this time of the year people tend to get this virus more.
Right.
What causes that?
Well, because we have a number of people coming into the country because of carnival, etc., bringing new subtypes of the virus. Also, people are socializing more around the time. So you would find you go to a party, somebody cough, you shake somebody's hand, because the influenza and the cold viruses, they're spread by droplet infections. So that's why we try to encourage persons to do proper hand washing, have proper cold etiquette. So if you're coughing, you don't cough into your hand and then shake somebody's hand. No, you cough into your elbow.
Yeah.
All right. Or if you're using tissue, you cough and you dispose of it. You throw it away. All right. Also, walk around with some hand sanitizer.
Yeah.
Hand sanitizer. That will also help in limiting the spread of the virus. Though.
Let's talk about the flu shot because some people, I had one person volunteering to do the flu shot for us live on air, which we are not doing today. But there are others who are saying, not me. I'm not having that. The side effects, people get sick after. Talk to us about the flu shot.
So the flu shot, like any vaccine, has it's good, all right? And there are those 1 or 2 cases where you might have some adverse reactions. And by adverse reactions, we mean at the site, the local site where you're getting the injection, you might have some redness, some soreness. Some unlucky persons might, develop an abscess. Or, unfortunately, 1 in a million might develop an allergic reaction or something called Guillain-Barré. So, overall, the flu shot is very safe, all right? Overall, it is a very safe vaccine.
Okay.
So people need to go and get their vaccination?
Yes.
Yeah. Do you get it before or can you get it during or it's too late?
No. So a vaccine is to help prevent you getting the infection.
Before.
So you have to get it before, all right? Not whilst you're having symptoms.
Okay. And how often do you get a flu shot? Is it once a year?
Every year.
Every year.
Because it's based on the strains of viruses that are circulating in the population. So that's why we want you to get it before so that it's preventive, prevents you from getting the symptoms.
Very Rishi, don't get it.
No.
Get the flu shot, but don't get the flu.
I need to find out
the
if somebody has the virus and they seem to be over it, like Lisa, should people around them be worried? No.
I don't feel like if I'm over it though.
Well, getting over it. Should we be worried to interact or be close to her, shake hands? Should we be worried at all?
So you shouldn't be worried.
Okay.
So once you have the virus, you would have built up natural immunity as well. So she would have built up natural immunity.
Okay.
But you don't go avoiding people.
I see people wearing the mask as well. The surgical mask.
Yes.
And I think spraying, like whether it's Lysol or any one of those type of antiseptics, they call those. Yeah, spraying it just to keep the place,
yes,
antibacterial kind of thing.
Yes. So as I said before, it's spread by droplet infection. So if you cough and the droplets fall on a hard surface and you touch that surface, you can pick it up. So that's why it's good to sanitize the area and stuff as well.